Hello, everybody. Thank you for having me here. I'm honored. Um, by way of a quick introduction, because I'm very scared of the clock, I am an associate professor and clinical psychologist at Stanford, work closely with the cancer survivorship team and the young adult cancer team led by Pam Simon, who will talk later. And a lot of my research focuses on oncofertility. And a quick disclaimer, within that, often focusing on the survivorship experience. So really thinking about the whole trajectory of cancer patients. So obviously everyone in the room knows this, but because of gonatotoxic treatments, patients and couples will often require assisted reproductive technology, surrogacy, or adoption or fostering to build their families. Whether or not they were able to undergo fertility preservation will, of course, impact their options and experiences. But nonetheless, for everyone, there's often informational, psychosocial, financial, legal, and logistical barriers. And so really the main focus of a lot of my work is how do we best understand patients' needs and support them through their family building experiences. Oh, sorry. Okay, so this was a study, just a cross-sectional survey and data analysis of young adult female cancer survivors. This was done at a single institute, Memorial Sloan Kettering in New York, who had a fertility preservation program. So 28% of the sample had undergone fertility preservation, was probably a bit higher than what would have been reported in the literature back then, almost 10 years ago. We asked those who did not undergo fertility preservation what were the reasons why, and you can see here the most frequently cited, and they could select more than one. So not having enough time, feeling too emotionally distressed, of course, not wanting to have children is certainly legitimate. Cost barriers and believing whatever happens is meant to be were the most common. And then that ultimately linked to decision regret, specifically for those reporting time constraints and emotional distress. We're reporting significantly higher levels of regret. And so really an indication of, these have long-lasting emotional, psychological impacts, these decisions and experiences. So that set us off on a little bit of a journey to understand what were patients' experiences post-treatment and how did they think about fertility and family building. We did an anonymous online survey, again, many years ago now, but of almost 350 young adult female survivors who were at least 1 year post-treatment. We partnered with a number of patient organizations to do this work. And as many as 87% were unsure of their fertility status post-treatment, had not had an evaluation, were really confused about what was going on with their reproductive health. And there were high rates of reproductive concerns. We use a reproductive concerns after cancer scale for any of you who that's familiar with. But ultimately, here are two examples. Those were the highest ranked items. Over 70% were afraid they wouldn't be able to have more children or were worried about passing on a genetic risk for cancer. Really a lot of anxiety about it. We asked them, well, so how are you feeling about family building, all of the family building options at this point? And high rates of unmet needs. So 87% feeling uninformed about their options, 74% unsure of their personal values, priorities, and goals related to family building options, 70% wanting more advice and guidance, and 35% wanting more emotional support in order to make these decisions and take, next steps. This was another study, so it's a cross-sectional analysis of a longitudinal study of 111 young adult female survivors we did just in the last few years, looking at a number of different things, but in this sample, 16% had undergone fertility preservation, only 38% had had a fertility evaluation post-treatment, and only 27% were satisfied with provider discussions about fertility in their post-treatment survivorship care. So we asked them, do you have as much information as you want about these various oncofertility topics? And, over half across the topics were saying, no, I don't have as much information as I want about risk of infertility or early menopause, options to evaluate my current fertility status, options to consider fertility preservation after treatment if it was possible and appropriate, and alternative family building options. So a lot of unmet information needs and feeling lost. And again, poor decision-making. So in this sample, 74% were scoring within the clinically significant range for decision distress regarding family building. And this was a validated cutoff score. Again, feeling uninformed, unclear about their own personal values, lack of advice and guidance, and lack of emotional support. And separately, data was indicating low self-efficacy for pursuing family building. So, for example, 35% were reporting low confidence they could even understand the information enough to be able to make a choice about their fertility and fertility care and family building. So providing information might not be enough, right? We need engaged conversations. Oh, sorry, I keep forgetting. Okay, so not surprising at all, financial factors impact all of these experiences. And this is something I feel really passionate about, the overlap between cancer-related financial toxicity and the cost of family building, right? So in this sim sample, we use the cost measure to evaluate cancer-related financial toxicity, and the sample was scoring in the moderate range, though 24% were reported severe levels. 48% were worried quite a bit, or quite a lot, or very much about financial problems. And when we looked at all these factors together in an overall regression model, controlling for covariates, greater financial toxicity related to higher levels of reproductive concerns, greater decisional conflict about family building, and lower self-efficacy. So obviously money matters, right? And these family building's expensive. Finally, this was a qualitative study where we asked women, so tell us how to improve survivorship care. And I think, the title speaks to it. Looking at future cancer survivors, give them a roadmap, but more specifically, give more information, offer emotional support, provide guidance for next steps. And this was really about, how do I navigate the healthcare system? What doctor am I supposed to be talking to? How do I figure out insurance? Improve communication. And this was about, providers don't understand, they lack empathy, that this is an important quality of life issue. Provide financial information, refer to peer support resources. So finally, you guys just heard my talk, you understand the takeaways, but I guess my recommendation would be better continuity and access for oncofertility care across the trajectory of the cancer patient experience. From pre-treatment to post-treatment, we need to be having these conversations, providing referrals when the patient is ready and interested, and making sure they have access, of course. Okay, I did it within time.